Welcome back, viewers. In today's video we will be discussing about the osteology of the radius. Okay, so radius is the lateral bone of the forearm. It is one of the bone of the forearm, and this is the lateral bone of the forearm. This is the pre-axial bone of the forearm, and this is corresponding with the tibia of your lower limb. So corresponding bone of radius in the lower limb is tibia. Okay, so this is the lateral bone of the forearm, and it is the preaxial bone of the forearm, and this corresponds to the tibia of your lower limb. Now coming to its presenting parts. Like any long bone, it has got a upper end, it has got a lower end, and it has got a shaft. It has got a upper end, lower end, and a shaft. Okay, so we will discuss in detail about all the parts and their attachments. Coming to the upper end, so this is the upper end of radius. So this is the upper end of radius. So upper end, it has got a head, it has got a rounded head, and then just below the rounded head it has got a constricted part which is called as the neck, and just below the neck you can see one rough area. This is the tuberosity, radial tuberosity. So the parts of the upper end are head, neck, and a tuberosity. Okay, so this head which is there, it is articular. This will articulate with the capitulum of your humerus to form the elbow joint. It will articulate with capitulum of humerus to form the elbow joint. So the immediate constricting part below the head is what we are calling as the neck. Next, below the neck you have got a rough area. See, this is the rough area. This is present below and in the medial part. Okay, so in this rough part which we are calling as the radial tuberosity, the posterior part is even more rough. And the anterior part is smooth. Okay, so this posterior part which is rough will receive the insertion of the biceps brachii muscle. That is the muscle of your arm. And this smooth anterior part which is there, that is related to a bursa. So the movements of the biceps while supination and all. So in order to provide for the lubrication, you will have a bursa over here to avoid friction. Okay, so that is about the upper end. It has got a head, neck, and a tuberosity. The posterior part is giving insertion to biceps brachii, and anterior part is related to a bursa. Next, coming to the shaft. This is the shaft of the radius. So the shaft, it is having three borders. One is the anterior border, posterior border, and the sharp introitious border. See, this is the sharp introitious border. Okay, so it has got anterior border, posterior border, and a sharp introitious border. So the anterior border, this is the anterior border. The anterior border, it will begin from the lower part of the radial tuberosity. You see, this is the anterior border. I am tracing the anterior border from the lower end of radial tuberosity. Okay, and it is passing below, and below in the lower end it is becoming prominent, and it is forming like a ridge. So this is the anterior border. So this anterior border, in its upper part, it will give origin to the radial head of flexor digitorum superficialis muscle. In the lower part, where you have seen it is becoming prominent, see, it is becoming prominent. This part will give attachment to the extensor retinaculum. Extensor retinaculum. Okay. So that is about the anterior border. Next, coming to the interosseous border. Interosseous border. So this interosseous border is the sharpest border. Okay, and this is facing medially. So this interosseous border, it will give attachment to the interosseous membrane. Interosseous membrane. This interosseous membrane will have a small opening in its upper part, which will allow for the passage of the posterior interosseous vessels and nerves. Okay. So that is the interosseous border. This is the interosseous border. See, it is extending from the posterior. It is extending from the posterior part of radial tuberosity and traced downwards. See, it is ending as the posterior part of this triangular area. You can see one triangular area over here. So it is forming the posterior part of this triangular area. So that is the interosseous border. Next, coming to the posterior border. So this is the posterior border. So posterior border, if you see carefully, it is not prominent in the upper and lower part, but it is prominent only in the center part, in the middle. Okay. So this is the posterior border of radius. So three borders: anterior border, interosseous border and posterior border. Okay. So coming to the surfaces. So in between the anterior border and your interosseous border, you have got the anterior surface. So this is the anterior surface of radius. In between the posterior border and the interosseous border, you have got the posterior surface. This is the posterior surface. In between the anterior border and the posterior border, you have got one surface, that is the lateral surface. Okay. So three surfaces: anterior surface, posterior surface and lateral surface. It has got three surfaces. Okay. So we'll see what are the attachments on each surface. So the anterior border first. The anterior surface first. Okay. So the anterior surface, which intervenes between your anterior border and the interosseous border. In the upper part of the anterior surface, this will give origin to flexor pollicis longus. And in the lower part, you just have a look at this triangular area. You're able to make it out. So this triangular area in the lower part, this will give insertion to pronator quadratus muscle. Okay, pronator quadratus muscle. Okay. So that is about the anterior surface. In the upper part, it is giving origin to flexor pollicis longus, and in the lower triangular part, it is giving insertion to the pronator quadratus muscle. Next, the posterior surface. So the posterior surface, it intervenes between the posterior border and the interosseous border. It intervenes between the posterior border and the interosseous border. So in the upper part, it will give origin to abductor pollicis longus. And in the lower part, it will give origin to extensor pollicis brevis muscle. Okay. Upper part, abductor pollicis longus. Lower part, extensor pollicis brevis. Next, the lateral surface. So this is the lateral surface. Okay. So in the lateral surface, in the middle of the lateral surface, you are able to make out one rough area. This is the rough area. Okay. So this rough area which is there, this will receive the insertion of pronator teres muscle of the forearm. Okay. And above this rough area, this part of the lateral surface, the upper part of the lateral surface will receive the insertion of the superficial and deep fibers of the supinator muscle. Okay. So in the lateral surface we have seen the insertion of supinator muscle and pronator teres muscle. Okay. So with this we will move on to the lower end of radius. So this is the lower end of radius. Okay. So the lower end of radius, it is expanded and it has got 5 surfaces. So this is the anterior surface, this is the posterior surface, this is the lateral surface, okay, and this is the medial surface, and this is the inferior or the carpal surface. Okay, 5 surfaces: anterior surface, posterior surface, lateral surface, medial surface, and inferior or the carpal surface. So 5 surfaces. The anterior surface is which is there, it will allow for the passage of the tendons of the flexor compartment of the forearm, and this is palpable means you can feel it below your skin. Okay, this allows for the passage of the tendons of the flexor compartment of the forearm. Next, the posterior surface. This is the posterior surface. You see one tubercle here, one prominent tubercle over here. So this is called as dorsal tubercle of Lister. This is called as dorsal tubercle of Lister. So if you see carefully, there is one groove which is present lateral to this dorsal tubercle of Lister, and there are 2 grooves medial which are present medial to this dorsal tubercle of Lister. Okay, so the one which is present laterally will lodge the tendon of extensor carpi radialis longus, and the medialmost one, that is this one. Okay, this groove will lodge the tendon of extensor carpi radialis brevis. Now what about this groove which is present just medial to this dorsal tubercle of Lister? So this groove which is there, which is present just medial to this dorsal tubercle of Lister, is for the passage of the tendon of extensor pollicis longus. Okay, so from lateral to medial, if you see extensor carpi radialis longus, extensor pollicis longus, extensor carpi radialis brevis. Okay, so that is about the dorsal surface, and this dorsal tubercle of Lister which is there, it will give attachment to one slip of the extensor retinaculum. Just like your flexor retinaculum, on the dorsal aspect you will have an extensor retinaculum. So one of these slip will get attached to this dorsal tubercle of Lister. Okay, next, the other surfaces. We have discussed the anterior surface, we have seen the posterior surface. Now we will see the lateral surface. So this lateral surface is elongated to form a styloid process. So this is the styloid process. This styloid process will give attachment, insertion to the tendon of brachioradialis. Okay, next, coming to the medial surface. So in the upper part of the medial surface, we have seen this triangular area will give insertion to pronator quadratus. So below this triangular area you can see one notch. You are able to make it out, this notch. This is the ulnar notch to articulate with the head of ulna to form the inferior radio-ulnar joint. Okay, and then coming to its inferior surface, or we also call it as carpal surface, because it will articulate with the carpal bones. So it has got a lateral triangular area and it has got a medial quadrangular area. This lateral triangular area will articulate with scaphoid, and this quadrangular area which is present medially will articulate with lunate to form your wrist joint. Okay, so lateral will articulate with scaphoid, medial with lunate to form the wrist joint. So that is about the inferior surface. So I just repeat, anterior surface, it is just related to the tendons. Posterior surface, it has got a groove which is called, it has got a tubercle which is called as tubercle of Lister, and it has got one lateral groove and one lateral and two medial grooves for the passage of the tendons. And then the lateral surface is elongated to form the styloid process, and this will receive the insertion of brachioradialis. Medial surface, it has got a articular surface to articulate with the head of ulna, and inferior carpal surface will articulate with scaphoid and lunate. Those are the carpal bones. So that is about the inferior end of radius. So now with this we will determine the side of this radius. So in order to determine the side of the radius, we put the head facing upwards, the tuberosity, it should be facing medially, and this sharp interosseous border should be facing medially, and the styloid process should be facing laterally, and this dorsal tubercle of Lister should be facing posteriorly. Okay, so with all these points in mind, we determine the side of the radius. So the radius which is there with me is the right-sided radius. Here I kept the head facing upwards, the tuberosity facing medially, interosseous border facing medially, and the styloid process facing laterally, and tubercle of Lister facing posteriorly. So this is a right-sided radius. Okay, so this is about the osteology of radius, which is the lateral bone of the forearm. Thank you for watching.